you a pitcher dealing with nagging shoulder pain that just won't go away, feels like you can't get wound up or loose? It might not just be fatigue, it could be a slap tear. In today's video, we're breaking down what slap injuries are, how pitchers rehab them, and the exact criteria you need to meet before getting back on the mound safely. Hey everyone, I'm Dr. Jeff Lewis, owner of Lewis Physical Therapy and Sports Rehabilitation, where I help baseball pitchers get stronger, recover from injuries, and get back to throwing pain-free. If you're a pitcher struggling with shoulder pain, you're in the right place. A slap tear stands for superior labrum anterior posterior. Basically, it's damage to the top part of the labrum where the bicep tendon anchors into the shoulder. In pitchers, this usually develops from the repetitive stress of throwing, especially in late cocking and acceleration, and follow-through, where the shoulder experiences extreme rotational and distraction forces. Rehab for a slap tear isn't a quick fix. There are 4 general phases, but before I break those down, let's talk about why this injury is so impactful and common for pitchers. The shoulder is an inherently unstable joint. Think of a golf ball sitting on a tee. The labrum help deepens the socket, providing extra stability that keeps the humeral head centered. It's what we call a passive stabilizer, meaning it doesn't actively contract like a muscle. Once the labrum is injured, that passive stability is now compromised. This then puts extra strain on the rotator cuff and scapular stabilizers, which are some of your dynamic stabilizers. These now have to work overtime to control the joint during the high-speed demands of pitching. That's why rebuilding cuff strength, endurance, and scapular control is such a major piece of slap tear rehab. Without sufficient dynamic stabilization, the humeral head has a tendency to shift around the joint, causing extra pressure on structures like the supraspinatus tendon or bicep tendon. Now, let's go through the 4 rehab phases. Phase number 1 is the acute phase. The goal here is reducing pain and inflammation, restoring basic shoulder mobility, and protecting the tissue. Phase number 2, this is the strengthening phase. Here we focus on the rotator cuff, scapular stabilizers, and restoring full overhead mobility. Because the labrum can't provide as much passive stability anymore, your muscles have to take on more responsibility. We'll also look at other components of the kinetic chain that could be predisposing to the shoulder dysfunction and pain that they're having. So this is looking at more maybe like the hips and thoracic spine. Phase number 3, this is the advanced strength and power phase. Here, we integrate plyometrics, progressive overhead stability and strength drills, and more sport-specific movement patterns. The last phase, phase number 4, is the return to throwing phase. This is a structured throwing program that progressively builds velocity, volume, and tolerance to game-like stress situations. Before you start throwing again, there are non-negotiables we need to hit from a criteria standpoint. First up, total shoulder range of motion. So this is your total motion, meaning your internal and external rotation put together, and this should be within 5 degrees bilaterally. Cross-body adduction, so here you must have adequate posterior shoulder flexibility. Limiting cross-body motion often signals excessive posterior shoulder tightness, which can drive stress into the labrum and other structures. Ideally, you want to have at least 90 degrees of motion here. External to internal rotation strength ratio. So external to internal rotation strength should be a minimum of 0.69 measured on a dynamometer before throwing, but preferably higher. If that balance is off, your cuff can't stabilize properly under high velocity throwing. Ideally, we want this to be as close to 0.85 to 1.1 before we get into high intensity efforts like bullpens. A proper return to throwing program is gradual and progressive. Here's what that typically looks like. Phase 1 is just starting light catch play. This could be at 45 to 60 feet. Light intensity, it might be around 25 to 40 throws over the first couple weeks, just focusing on smooth mechanics and no maximal effort, just getting comfortable with throwing again. Phase 2 is building that distance out to 120, 135 feet. So depending on the injury, this could be over a few weeks or over a few months. We gradually increase that throwing distance. The goal here is just to get some progressive stress on the arm. It's not hard on a line, it still has a little bit of carry to it. Phase 3 is a higher intensity flat ground work. So once we're thrown out to 120, 135, we might at that same time start to come back into 60 feet and get on some more throws with higher intent, more on the line, simulating the pitching motion. After that, phase 4 is starting bullpens. Here we might start with maybe 10 to 20 pitch bullpens at controlled intensity, then gradually build volume, intensity, and pitch types. We don't want to jump right into max velocity effort pitching. It's a progressive ramp up. Phase 5, live batting practice. So now the pitcher is going to face hitters in a controlled environment to allow for a gradual increase in intensity. Lastly, phase 6 is returning to games. So finally, once volume, intensity, and recovery markers are solid, we start to get into game action. This is always the last step, and only after all their boxes have been checked. Even once you're back, the work isn't over. One of the most important things pitchers need to maintain is rotator cuff strength and endurance. That means continuing with arm care routines, so heavy cable or resisted external internal rotation exercises, rhythmic stabilizations, crawling patterns, and scapular work throughout the entire season. Think of this as your maintenance program. You wouldn't stop changing the oil in your car just because it's running fine. So if you're a pitcher dealing with a slap tear, remember, rehab is a process. You need to check the right boxes with range of motion, strength, and mechanics before you ever get back on the mound. And once you do, ongoing arm care is non-negotiable if you want to stay healthy and perform at your best. If you're struggling with shoulder pain and want my full blueprint for rehabbing arm pain in pitchers, text arm pain to get your free copy of the arm pain blueprint. And as always, don't forget to like this video, subscribe to the channel, and drop a comment below with your questions about slap tears or throwing injuries. We'll see you in the next video.